So with us today, I've invited a member of, he's actually a member of the tanning industry, and he's on our conference line. Smart Tan is the organization. He's vice president of the organization. Joseph Levy, welcome to the program.
Thank you, Dr. Hoffman. Thank you for having me here today.
Nice having you. And let's clear it up. Full disclosure here, I am not a paid representative of the tanning industry, right? Correct?
Absolutely not.
I'm a physician with an open mind, interested in the overall welfare of my listeners and my patients. Now, you, however, this is, let's face it, this is an advocacy organization for the tanning industry, is it not? Clearly you're part of the tanning industry. It's in your interest to push back on laws which restrict access to tanning. Quite frankly, right? Well,
I'll tell you what we are. We are an educational institute to help the facilities run as professional as possible in North America. And I got into this 18 years ago and was hired to do a research project. Asked, does tanning cause skin cancer? And I spent the first 6 months researching that question before the Internet was publicly available and before research was readily available to the layperson. And what we found then is what continues to be true now. There is still no data to suggest that tanning in a non-burning fashion for people who can develop tans is a significant risk factor, and that is the caveat that people ignore.
Right. So, in other words, we have an analogy here. We have in the global warming argument. It is said that this is settled science, and yet we have people who now have signed on to the proposition that tanning is an absolute evil. That it is. They're equating it with cigarettes, for goodness sakes.
And I will tell you something, Representative Maloney. Cigarettes are the cigarettes of our time. That is a third rail of public health, and don't mess with that. Do not attempt to compare something natural and intended to cigarettes, which 1 in 3 cancer deaths are related to tobacco. Tobacco is tobacco. There is nothing like that. It is an unnatural substance our bodies were not intended to process. Ultraviolet light is essential for life on our planet, and to say that UV light is harmful and should be avoided is akin to saying water causes drowning and therefore we should stop drinking water. What a complete misrepresentation of the relationship. The science is not settled on this issue, and in fact, that's why they're going out so strong right now. This is a last gasp effort. You had mentioned vitamin D at the top of your broadcast. The vitamin D movement has gained such momentum, and we know that vitamin D deficiency is caused by the fact that we do not get regular sun exposure anymore. We live and work indoors. We don't get regular UV light like we were intended to. And so now that we know that, and now that we know we need much more vitamin D than we used to think we did, and I suppose we'll have opportunity to talk about that, this is the last gasp effort by the dermatology community and those who manufacture and overmarket chemical sunscreen products to attempt to vilify any and all UV light. It is a appalling situation.
By the way, if we look at it, if we follow the money trail and we look at the money that is donated to the campaign against tanning, which is mostly funneled through the American Academy of Dermatology and advocates, a lot of the money comes from companies like Johnson & Johnson, companies that make
Plow, Johnson & Johnson, Neutrogena.
We slather on millions and billions of dollars worth of this stuff with the belief that, to some extent it's true. You do not want to get a blistering tan in the middle of August near the equator. That's going to be trouble.
Well, the fact is, sunscreen, chemical sunscreen, is a chemical product. Let's not kid ourselves. This is a chemical that is not innocuous. We know it does get into our bodies and into our bloodstream. Oxybenzone, the main active ingredient in chemical sunscreen, is now present in 97% of people's urine, according to the Centers for Disease Control. This is not an innocuous product. It was designed to be used to prevent sunburn on occasions when sunburn was possible. And the tanning industry, believe it or not, sells that product properly. We sell it for its intended use to help prevent sunburn when sunburn is possible. However, the people who are marketing sunscreens now are marketing it as a daily use product. And
like you're walking down the street. Goodness, you might get a few rays on your nose, and that could increase your risk of cancer. How's that?
I will tell you this: if you look at the studies on sunscreen, there are more studies showing that people who wear sunscreen have higher risk of melanoma than there are saying that they reduce the risk of melanoma. And the government does not allow a sunscreen company to claim that their product prevents skin cancer. The sunscreen companies can't make that claim themselves. So they pay the American Academy of Dermatology, the American Cancer Society, and other groups millions of dollars to put the stamp of approval on the product, which gives the consumer the
it's
impression
a pay-to-play. It is clearly a pay-to-play proposition.
And there are dermatologists that are very upset about that they are selling their endorsement when they shouldn't be because they sell their credibility with it. There's no. You mentioned Carolyn Maloney's bill. Was the press conference?
Can we do this? Hold your fire for a minute because we need to get to commercial break. I know you have something important to say about the origins of this new piece of legislation that will enable the federal government to regulate yet another thing that we do. Thank goodness that they are the guardians of our health and well-being. I'm Dr. Ronald Hoffman, and this is Health Talk. Back to Health Talk. I'm Dr. Ronald Hoffman. We're talking about tanning. This month in Cosmopolitan magazine, I'm looking at the cover now, you can learn about 99 sex moves. You can also find out what makes a woman irresistible and get this important new feature. Get long hair fast. The secrets to hair growth. And you can learn about how bad tanning is for you, courtesy of editor. The editor of Cosmopolitan magazine is in league with Representative Maloney, House of Representatives from New York, in an effort to regulate and curtail our access to dangerous tanning. Yes, indeed. So we've invited a guest. He is Smart Tan Vice President Joseph Levy. And, Joseph, break it down for us. So what about this legislation that Representative Maloney is proposing?
As I mentioned, it was no mistake. It was done in the press release, and the media release was done in Cosmopolitan magazine's office. Cosmopolitan features more than $1 million every month in anti-UV-related advertising, in advertising designed to tell you to avoid every single photon of UV light, that you need to wear a daily sunscreen product.
So what's the average vitamin D of the teenage readers of Cosmopolitan magazine?
I don't know that, but I will tell you this. What we know now about vitamin D is that the only people who naturally have vitamin D levels that the vitamin D research community now recommends are people who get regular sun exposure and indoor tanners as well. Tanners have vitamin D levels around 42 nanograms per milliliter on average, according to several studies on this topic.
For our listening audience, that would be. Did you say nanomoles per or nanograms?
I said nanograms,
which is
milliliter,
optimal. Which is optimal.
Yes, if you multiply that by 2.5, you get nanomoles.
We want it over 40. To prevent osteoporosis, you need it over 40. To prevent autoimmune diseases, cancer, diabetes, that's about the level you want it to be. However, probably only about a third of the population, especially young women, and certainly people with darker skin, African Americans, Hispanics, people from South Asia originally, they have much lower levels.
Yeah, the average American today has vitamin D levels around 20 nanograms per milliliter. And interestingly enough, Dr. Hoffman, there was a study done in Australia last year that was published that Australian dermatologists at the end of summer averaged 13.8 nanograms per milliliter, which puts them at risk for rickets.
Yeah, so they're really following their own instructions, right?
And what is so interesting about this, about vitamin D, is everybody used to think vitamin D was just for bone health, that it helped your body process calcium, and so you only needed a certain low amount. But it's only been in the past 10 years that they've unlocked that vitamin D, every cell in your body has a vitamin D receptor, which means that the cells need vitamin D in order to regulate cell growth properly and properly program cell death. So that, which unlocks the mechanism by which having natural vitamin D levels between 40 and 60 nanograms per milliliter helps to reduce the risk of many forms of cancer. And like I said, the only people who are naturally getting those levels are people who are getting at least 2,000 units a day.
So I'll ask you
once they are vitamin D sufficient, having those levels.
Right. I'll ask you the question. Most people don't take vitamin C. The people who listen to this program, they're into it. They take